terms of background, it's important to note that although more and more people are spending more time on other screens, such as watching smartphones, TV viewing remains the predominant leisure-based sedentary behavior, and observational studies show strong associations between longer TV viewing times and worse health outcomes, such as higher mortality rates. And those associations are stronger for TV viewing than they are for other sedentary behaviors, such as sitting whilst at work or driving. And although we know the risks are strongly associated with TV, we still don't know how much TV watching is too much. Further, there aren't current specific guidelines around sedentary behavior or TV watching like there are for physical activity. The current guidance in the US and the UK are very similar, and they just broadly recommend that adults generally minimize the amount of time they spend sedentary. One of the reasons that there aren't current specific guidelines on how much TV is too much or how much sedentary time is too much is because the evidence base doesn't allow that, and there's a lot of research still needed to try and understand what the critical elements are about TV viewing that actually cause the harm. Hello, my name is Dr. Hamish Foster. I'm a GP or a family physician, and I work as an academic fellow at the University of Glasgow in Scotland. This is a short presentation of our study entitled Understanding How Much TV is Too Much, which will be appearing in Mayo Clinic Proceedings. I'll give a brief overview of the background or rationale to our study, some of its key findings, and how it extends previous research in this area. So we wanted to find out what level of TV watching is associated with the least amount of harm, and therefore try and contribute to the body of evidence that might help develop future, more specific sedentary behavior guidelines. And we did this by analysing a large prospective cohort, the UK Biobank, which has a huge amount of data on around 500,000 adults aged 37 to 73 that were recruited between 2006 and 2010, and their data is linked to routine death and disease registries. The mean follow-up period for our study was around 7 years, and we looked at participants' risk of all-cause cardiovascular and cancer mortality, as well as cardiovascular disease and cancer incidence by their level of TV watching. We used slightly more detailed analyses than previous studies, looking at the non-linear associations, and there were also some important elements of our study, of our analyses, that helped us reduce the chance of reverse causality, where poor health might lead to longer TV viewing times. And what we found in our analysis was similar to previous studies in that longer TV viewing times were generally associated with worse health outcomes. But more specifically, what our study showed was that the association between TV time and cardiovascular disease incidence was close to linear, whereas the associations between TV time and all-cause and cardiovascular mortality was curvilinear. And we could see that the lowest level of risk for those outcomes was at around just under 2 hours a day. Then another analysis that we did to extend what's previously been done in this area is we studied at person level how outcomes were associated with TV when we reduced TV time by substituting in alternative activities, potentially healthier activities. The ones that we looked at were sleep, walking, moderate and vigorous physical activity. And what we found here was that reducing TV time by substituting in alternative activities was generally associated with improved outcomes. However, we only really saw this for those participants who had low levels of that alternative activity in the first place. So in other words, for example, if you watch a lot of TV but don't walk very much, then you potentially might have the most to gain by reducing TV time and replacing it by doing more walking instead. Then, to estimate the impact of reducing TV time at population level, we did two things. First, we calculated population attributable fractions, which estimates the amount of reduction in adverse health outcomes if all participants, in theory, limited their TV time to the lowest risk level. And here we found that 6.02% of all 10,306 deaths were attributable to TV viewing. And then we calculated potential impact fractions, which estimates the amount of reduction in adverse health outcomes if all participants limited their TV time to 3 hours a day or 2 hours a day. And here we found that limiting all participants' TV time to 2 hours a day would have prevented or at least delayed 5.6% of all deaths, which is equivalent to 93.4% of those deaths attributable to TV. So two key messages are: one, our paper provides new observational evidence that suggests if adults limit their TV time to 2 hours a day or less, then perhaps most of the adverse health associated with TV could be prevented or at least delayed. And two, if adults reduce their TV time by substituting in alternative activities, then that could also reduce the adverse health associated with TV. Of course, there are a number of limitations with our paper, and there's a lot of research still needed to be done before we can make firm recommendations on TV time. However, our paper makes novel contributions towards achieving that goal. Thank you very much. I hope you enjoy reading our paper.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.